Hand washing. Use a barrier, cut on your water faucet. You want to use warm water during the skill. Make sure that your watch is up so that it allows you to wash your wrist. Wet your hands first. Apply soap. Provide 20 seconds of friction to your hands. Make sure you get in between your fingers, around your wrist, and up and down every finger. Last, clean your nails. Clean around each cuticle and under every nail. When you rinse, be careful. Try not to touch the sink. If you touch the sink, you have contaminated your cleansed hand. Be sure to remove any soap that's remaining on your skin. Cut off your water. As you dry, be sure to only start at the part that has been washed and is wet. Pat your hands dry. When the napkin becomes saturated, get another one. And now you can perform your skill on your patient. Blood pressure. Select the appropriate size cuff based off of your patient's or resident's arm size. You'll need a blood pressure cuff, your stethoscope, and alcohol. Clean the diaphragm of your stethoscope as well as your earpieces. If using a double stethoscope, make sure you clean your earpieces and the instructor's earpieces as well. Mrs. Jenkins, may I take a blood pressure on your left arm?
Yes.
Okay. Support the resident's arm. Make sure that the end of the cuff is 2 finger widths above the antecubital area or the inner bend of the arm. You want the cuff at the level of the heart. From the pinky up, locate your brachial artery. This is where you would want to place your stethoscope. Safely inflate your blood pressure cuff. For your first blood pressure, do not go above 160. Slowly decrease the pressure on your cuff. The first thump you hear is called the systolic blood pressure. The last thump you hear is the diastolic blood pressure. Remove your blood pressure cuff. Document your numbers. And clean your equipment at the end of your skill. Miss Jenkins, I'm here to do your pulse and respiration. So I've already washed my hands and I've closed the door for privacy.
Okay.
And I'm going to begin now. Count the pulse for 1 full minute. Then watch the resident's chest rise and fall for another full minute. 1 exhalation and 1 inhalation equals 1 breath. Okay, Miss Jenkins, I've finished your pulse and respirations. I'm going to go document now. You have your call bill. Anything else I can do for you?
No, thank you.
All right, thank you very much. Wash your hands and document. Miss Jenkins, let's make sure your feet are flat on the floor. We're going to get you to the scale and weigh you today, okay?
Okay.
All right, on the count of 3, I'm going to help you up. 1, 2, 3. Are you dizzy?
No.
All right, let's slowly walk to the scale. Let me stop you. I'm going to 0 the scale first. Let me assist you onto the scale. Very good. I have an arm behind you for safety. Very good. Let me help you step off the scale. Okay. And can you turn around for me? We'll walk slowly to your chair. Document your findings, wash your hands, and give the resident the call bill before you leave the room. Feeding. To perform feeding, you will need a clothing protector, washcloths, water, a spoon, and the food of the resident's choice. Gather your supplies and move your bedside table. Miss Jenkins, I need to raise your head before we start feeding you.
Okay.
How are you doing today?
I'm good, thank you.
Would you like applesauce or pudding?
Applesauce, please.
Okay. Would you like to wash your hands before we begin?
Yes, please.
Raise your patient to a minimum of 60 degrees. Wet half of a washcloth and leave the other half dry. Ms. Jenkins,
Thank you.
your hands, please. Thank you. Take soiled linen to the hamper and apply gloves before feeding the resident. Ms. Jenkins, I'm going to put your clothing protector on. How have you been doing today?
Good, thank you.
Get this around your neck. Is it okay if I sit you up a little more?
Oh, absolutely.
This is for your safety. We don't want you choking. I'm going to start off with some water. Did your family come by yesterday?
They did.
Very good. Did they bring the puppy?
They did. It's getting big.
Start off with some water. Did it go down? You wipe your mouth. You like this applesauce.
Thank you.
Yes. Make conversation with the resident. Use a spoon to feed. Good. And make eye contact. Can I see if it went down? Good. Very good. And one more bite for me. Very good. Can I give you some water to wash that down with? And I'm going to wipe your mouth again. Would you like some more to eat?
Yes, please.
Very good. When you're feeding a resident, always make sure they're swallowing before you proceed with the next bite or any water. Just want to make sure. Open up. Very good. Some water. You did so well today. You're eating much more.
I have an appetite finally.
Yay! Clean up your supplies, take off your gloves, wash your hands, and then document the food intake in percentages. I'm going to save this in case you want it for later. When you're removing your linens, remove them away from you so that you do not contaminate yourself or clothing. Place your linens in the hamper. Take off your gloves. Wash your hands. I'm going to document that you ate 25% of your applesauce. And And we're almost done. Let me take off your clothing protector. You have your call bell. Would you like to be lowered any?
No, thank you.
Is there anything else I can do before I leave you?
I don't think so.
You have a great day. The next skill we will be demonstrating will be mouth care brush teeth. You will need a clothing protector, a washcloth, toothbrush toothpaste, a cup of water, and an emesis basin. You also must wear gloves for this skill. Miss Jenkins, we're going to raise the head of your bed. I have to sit you up some more, okay? I'm sorry. Let me know if it's causing you any discomfort. Is that okay? Apply your clothing protector. You can sit up for me just a little bit. Thank you. We don't want to get anything on that beautiful gown. Would you like to rinse your mouth before we start?
Please.
You can either swallow it or spit it out, either one you like. You swallowed? Wet your toothbrush first. Got your favorite flavor toothpaste, bubble gum. Apply a small amount of toothpaste. Brush all surfaces of the teeth and the gum line. And you can close for me. Get them together. And I got gloves on. Let me get around. Very good. You have beautiful teeth. I don't want to hurt you. Am I hurting you any?
Mm-mm.
Make it up top. Do you need the rinse now? Or can I go to your tongue? Stick your tongue out. And I apologize if I'm hurting you. This for me. We're going to have you rinse again, okay? And then I'll wipe your mouth. Rinse again. And wipe your mouth and your chin so I can make sure everything's dry. How do you feel now?
A lot better, thank you.
I'm going to clean up my supplies and I'll be back to remove your clothing protector. To the toilet and flush. Rinse your equipment. Dry your equipment. Disinfect if the nurse asks you to. Store your equipment. Do not contaminate the door handle. Have a separate barrier for the door. Any supplies you've yet to store, go ahead and do so now. Close your cabinet back. At most test sites, the toothbrush is disposable. Miss Jenkins, I'm going to go ahead and lay you back some, okay?
Okay.
Is that okay?
Mm-hmm.
You have your call bill. Is there anything else I can do for you?
No, thank you.
Tidy up your room. Take off your gloves. Wash your hands and exit the room. Before providing denture care, line the bottom of the sink with a washcloth to protect the dentures from breakage. Use cold water only on your dentures. Remove your dentures from the denture cup. Wet your dentures. Wet your denture brush. Apply toothpaste or denture cleanser. Brush all surfaces of the denture, including the gum line. Rinse your dentures and also rinse your brush. When you're storing your dentures in water, place water up to the gum line. Remove your washcloth. Place it in the soiled hamper. Get a clean barrier to store your equipment.